Good morning, everyone. My name is Carla Pegues. I am the program director, department chair, and also a faculty member of the dental assisting program here at the College of Alameda. To start off, I want to show you a quick little video about the program, and then I'll go into some more details. The College of Alameda Dental Assisting Program is a wonderful program. It's an accredited program. We've been with the College of Alameda for over 50 years. It has great recognition within the community. It's a wonderful job opportunities out there for you. Students in this program will learn how to become a dental assistant. They will be able to utilize their personal skills. After completing the program, you can become a registered dental assistant after you take your state boards. You can work in front office, you can work in lab, you can work in public health, and you can work in hospitals. Once they have completed the program and passed their boards, they are able to work in general dentistry, pediatric dentistry, oral surgery. So today in lab, we have two different labs going on. You have one which is dental materials. The students will be mixing gypsum products, which is a plaster, and they're going to pour up study models. And then you also see dental radiology, where the students will learn how to take x-rays using a digital machine. We have wonderful teachers, we have a wonderful staff, and this is a beautiful campus. So just a little history and background on the dental assisting program. The dental assisting program, which a lot of people probably do not know, was initiated in 1949 at Laney College. And in 1970, when they opened the College of Alameda, the dental assisting program transferred to the College of Alameda campus where we are today. The College of Alameda is one of the most established and nationally organized dental assisting programs in Northern California. We're a fully nationally and state accredited program. The dental assistant program is a full-time program, which is 2 full semesters. We start each cohort in August, and the students are completed with program in May. So our students are really sought after. Over 80% of our students get hired from their internship. For our class this year, 90% of the students already have a job. And there's plenty of job opportunities out there, and they definitely are being sought after, and they have opportunities to make a choice which office and which location they want to go to. So the demand for dental assistants is very good and very high at this time. The starting range is from 22, and that's graduating. Once you pass your state board, you can move up to $25 to $30 an hour. And of course, that depends on which office and where your job is located. Different cities offer different pay, but the opportunity is definitely there. Fall semester, it consists of 7 classes. You would have oral anatomy, which teaches you about the teeth and the body functions and anatomy of the head and neck. We also go over infection control, which teach you how to properly put on and remove your PPE, about disease transmission, and how to sterilize instruments and properly clean your room. Then you have radiology. Radiology teaches you how to take different types of x-rays, and of course, the safety of how to take x-rays without overexposing yourself or your patients. We also teach dental materials. Dental materials teach you how to manipulate and use all the materials in dentistry. Chairside procedures will show you how to do the hands-on work at the chair with the doctor. You also get your certificate and your license for corona polishing. And you will also learn professional standards, which is all of the legal aspects of dental assisting. In the spring semester, 17 units. This semester is really, the students really enjoy this semester. And one of the reasons why this semester is really enjoyable is because the students get to go and participate in their internships. So what we do is we assign each student to an office or a clinic. And sometimes you actually get to participate in Highland Hospital, and you go there 2 days a week during the semester for the full semester, and you actually participate in working in an office. So that area of the semester is really interesting and the students really enjoy it. Then you will have clinical rotations and review. We go over all the specialties. That way we give you an in-depth look at all the different choices that you have as a career choice within dental assisting. Advanced chairside procedures is you do more hands-on and more like making temporary crowns, teach you how to make temporary bleaching trays and how to adjust dentures and things of that sort. Advanced technology, you will actually take x-rays on live patients. Then biodental science is our medical emergencies class. So you will actually learn how to participate and work with any kind of medical emergencies that may arise in your clinics. We also have Pitt and Fisher sealants. Pitt and Fisher sealants is also a licensed course. So after you complete this course, you will actually receive your license to apply Pitt and Fisher sealants. And then we have last is our practice management class. Practice management is a class that teaches you how to do front office duties. You learn how to do billing, scheduling, and then you also learn how to do some payroll and some accounts receivable. Along with these classes, you also have 3 general ed classes that you need to take to complete the certificate of completion. We have an English 1AS or higher, psychology 1A, and communications 1A 20 or 45. What is the cost of dental assisting? Our cost is fairly low compared to some of the other colleges out there. The cost for dental assisting is approximately $5,000 to $5,500 for both semesters. And this includes your tuition, books, uniforms, and you also have a student kit. The student kit consists of your PPE, some of your materials that you will need throughout the program. Compared to some of the private colleges like Career or Carrington, where there's $20,000 to $25,000, ours is fairly reasonable. So this is just an example of some of the different careers that you can have once you complete the program. So we have general dentistry. And if you're interested in working in ortho, you can work in an ortho office. We have pediatric dentistry. We have endodontics, oral surgery, and prosthodontics. What is really interesting that I find interesting and most students don't know is that you can also work in forensic dentistry. And that's another career path that you can go into, and you can also work as a lab tech. So we have several different options that you can choose from. And if you don't want to work in the back with patients, you can always work in the front office as a receptionist or the billing clerk, management, or a treatment coordinator, which help coordinate the treatment and help walk the patients through the process of receiving treatment from the beginning to the end. So this is the dental radiology. This is some of the dental x-rays that you will learn how to take. Here is our Panorex x-ray. This is the x-ray of the full complete mouth. And then you have here, you will see your bite wings to take a picture of the upper and lower teeth. And this lower one is what we call the FMX. It's a full mouth series. So it takes a picture of all of your teeth. And of course, most of us have dental x-rays. We take these so we can see what's going on inside of the mouth that's not visible to the eye. So we can see exactly what's going on and be able to diagnose you properly. And then here is how we take x-rays in a clinic. So right now I'm just going to open it up. If anyone has any questions that I can answer, we can take a few minutes to have a little Q&A.
Someone asked, how can we apply for this program?
So to apply for the program, there is a application online. So you have to first be a student of the Peralta College. Then you will submit an application to the dental assisting program, which is online. And then I will contact you and then we'll start the process from there. It's pretty simple. So first come, first serve.
I have a question for you.
Yes.
When you were showing the clinical rotation and review slide, or you were talking about the clinical rotation and review, into different areas of dentistry you could go into?
Yes.
A couple of them ended in some kind of Dante, and I didn't know what you meant. So could you say what those?
Okay. So this first one here at the in the upper corner is general dentistry. So that's just your basic general dentistry where you go and get your cleanings, You go and get your fillings and any kind of normal, regular day-to-day operations. And then this one with the braces is your orthodontics. So this is where you put on braces, you can get mouth guards, sport guards, or anything like that.
Okay.
Pediatric dentistry is when you're working with kids. So it's from 1 year old to 18.
Oh, okay.
And then this one, I don't know if you can see this because of the pictures, but this is for forensic dentistry. Forensic dentistry is post-mortem. So that's after someone has died and we need to try to identify them by their teeth. So that's what the forensic dentistry is. Your prosthodontic dentistry is your dentistry that is making dentures or partials. And then this is your oral surgery. So this is where you get your wisdom teeth removed, and any surgery that you need that has to deal with the neck up, you would go to the oral surgeon for that one.
Okay.
And then this is your endodontic dentistry. This is where you get your root canals. This is where root canals take place.
And could you say it again? Endodontic?
Endodontics.
Endodontic. Okay, great.
Endo, yes.
All right, thank you.
I'm actually missing one, which is your periodontics. And perio is, they deal with the gum tissue. So if you need a gum graft or anything like that, then you will go to your perio surgery.
Okay, great.
So
Thank
we
you.
prepare you for all of them.
Beautiful. Thank you.
You're welcome. Thank you.
So our students, where are they practicing? Are they practicing on mannequins or are they practicing on real people?
In the first semester, you're practicing on mannequins. The second semester, when you enter your advanced courses, radiology, and Pitt and Fisher, you're actually dealing with live patients.
And how long does it take before they're working with live patients?
The first semester. So the first semester, they're dealing with just with the mannequins. Actually, I'm sorry, let me correct myself. The first semester, they're doing corona polish, so they do live patients then. And that's at the end of the semester. So it'll be like 14 weeks. And then the last 3 weeks is live patients of the semester. And then the spring semester, you're dealing with live patients because you're in your internship. So you're dealing with patients. And then when you come back to campus, you're doing your x-ray patients and your Pitt and Fisher sealant patients.
So you said internship. So how does that work? So when students go into this program, are they getting an internship?
Yes, that's part of the program. So once you enter the program, the second semester, you go into your internship. And what you do is you kind of give me an idea of your area of choice where you are interested in going to, and then I'll assign you to an internship office. So we have a lot of offices that are looking for our students to be part of the internship because they want to hire our students. So this is a good leeway to a job is through the internship. So you go there, you work for half of the semester in a general office. And then the second semester, the second part of the internship, you go into a specialty. And then after that, you graduate and then you're ready to become employed.
And how many hours do they need to do for the internship?
It's a minimum of 300 hours.
So that takes the entire program to complete?
Yes.
Or can someone say, oh, you know what, I'm just gonna do it full time and then I'm gonna get done with it in 3 months?
Well, it's part of the classes. So you have to go along with the program. So we start in January and we end in May. Like our students now, they have 2 more weeks of their internship. So yes, we can't just like finish really fast and then be done because it's part of the program. But it definitely takes the whole semester to finish your hours.
Well, actually, it's me again, Professor Pegues. When I was showing the CE brochure about assisting, one of the opportunities was in education, right? It
Yeah.
actually made me, I'm wondering if you'd be willing to share a little bit about your own path, and then also just touch a little bit on the opportunities in education that dental assisting students can get to if they want to.
Okay. Well, I am actually a graduate of the College of Alameda Dental Assisting Program. I graduated in 1997. I was 23, 24 years ago. I went and worked in the field for 18 years. After graduation, I worked in ortho for 10 years. And it was actually my internship office that hired me. And then I went into oral surgery. And after that, I went, and my whole path to education is I was always the trainer in my offices. So I will always have to train all the new employees that came in. So I kind of figured, well, if I can just train all the new employees and I'm reaching one person at a time, why not go into education and reach more and teach more people all of the skills that I have acquired during my years in practice. So I started taking my general education classes. I first got my AS in dental assisting. Then I got my AA. Then I went to college and I received my bachelor's. And then I applied to the College of Alameda, and here I am. So I started off as a part-time faculty, and I was working and teaching, and I discovered I really enjoy what I'm doing. And then someone was retiring and I applied for the position, and here I am 9 years later. So it's been a very eventful. I really enjoy what I do. I love the communication and the relationship that I build with my students. And to this day, I'm still in contact from my first class from 2011, 12. So it's really good to see my students move up and go into the world and do what I did for so long and enjoyed. And now what I'm trying to do is some of those students that have graduated, I'm trying to get them back into the classroom, but not the role as a student, but at the role as a teacher. So yes, you can definitely go from being a student to coming back to the classroom and teaching. And I think the best lesson, the best education that you can actually have is being out there in the field, because you learn so much being in the field to bring back to the classroom. So yes, I was in hopefully one of your shoes one day and I loved it. So yes.
All right, great. Thank you.
You're welcome. Thank you. I was meant to get to that point.
So we have a question in the chat. Is there a scholarship, or do students have to pay for supplies, or how do they pay for the program?
Well, to pay for the program, you can apply for financial aid. We have EOPS, and then you can apply for scholarships. We personally do not have any scholarships in the dental assistant program, but I do have some doctors that are willing to sponsor some students. I've had interest in sponsorship from some of our community doctors that want to help more students get into the program. So that's something that we can talk about once I have a student that's interested or in need of a sponsorship. I can definitely reach out to our doctors, and that would be something that can help them.
Just as a follow-up, what about materials for the class? Are there materials for the class that the department covers, or do students need to buy like their own kits?
Yes, well, students have to buy their kit. There is a small kit that comes with your typodont, some of your disposable materials like your PPE. Some materials are in the kit, and the kit ranges between $500 and $600. But again, that can be covered with your financial aid if you receive financial aid. EOPS purchase, if you have EOPS, that will help you with your books and your uniforms. So you come out of pocket some, and when with the range with 5,000 to 5,500, that is a rough estimate, and that's me including transportation when you had to go to your internships, because sometimes we go to UCSF Dental School. That's part of BART fare, and I know the school gives some help with bus passes and BART and the Clipper card. So yes. There is some out-of-pocket costs involved, but hopefully if you get in financial aid, that will help cover it.
So how does someone get a hold of you?
You can reach me at cpegues@peralta.edu. And if you reach out to me, like right now, I'm still taking applications for this coming fall. So if you're interested in the program, now is a good time to submit your application and to reach out to me so I can help you walk you through the process.